TPLO procedure is the most common orthopedic procedure that we perform here at CVETS, and the most common that we perform to treat cranial cruciate ligament rupture or insufficiency in dogs and cats as well from time to time. The TPLO stands for tibia plateau leveling osteotomy, and that's a lot of medical jargon, but what it essentially means is that we are redesigning the joint to make it so that that ligament is no longer needed, which is important because in the vast majority of these pets, they have a degenerative process going on, so there's actually no ligament to reattach. And so we make a circular bone cut in the top part of the shin bone, and then we rotate that fragment. And what it does is it takes, on average, a slope of about 24 degrees and flattens it to a slope of about 5 degrees or so. And so when a dog then walks on that leg, there's no longer a slope for those two bones to slide against each other. And so it makes them what we call dynamically stable. In order to keep that bone fragment in the position that we want it in, we apply a surgical grade stainless steel bone plate, typically with 3 screws up top and 3 screws down below. For giant 3 dogs, sometimes we'll use what's called a broad plate that has 4 screws up top and 4 screws down below. Generally, the healing process takes about 8 to 10 weeks for us to see good signs of bony healing, during which time we have clients refrain from high impact activity. So in general, no running, no jumping, no playing, and no off leash activity during that time frame. We get pups back in for recheck x-rays at around that 8 to 10 week time point, evaluate our healing, and if all looks good, generally have that pet return to activity over another 3 to 4 weeks. In general, I tell folks the prognosis associated with surgery is good to excellent, with the vast majority of pets getting back to near normal activity, if not normal, following their 2 to 3 month convalescent period.